Well, good afternoon, everybody. So, this is the inaugural talk on the StreamYard platform, and I hope that it will work in the sense that there will be no interruption like the last time. And this time it will end with me displaying a QR code so that you will be able to scan it with your MMA app, and you'll be able to get one CBT point just by listening to the talk. Feel free to use the chat below to ask any questions. Okay, so if you have any time you want to stop me by asking something, I'm happy to answer your questions. But this is just a text chat system. All right. It will be recorded in any case, so the YouTube stream will be available for off viewing uh, later on as well. So this would be a way to watch this, but the points will not be captured live. I'll think of a way for you to submit to get points after watching the video, but can't promise that it will work. Okay. So I'm going to start the presentation soon. So the talk is on teleconsultation best practices and tips, especially if you're new to teleconsultation. Teleconsultation has taken off in a big way since the COVID pandemic, where people are afraid to come to hospital. Doctors also are a little bit nervous when seeing patients in hospital, and a remote way of connecting with your patients is the safest way. I mean, it's a way of actually social distancing virtually. It doesn't solve everything, but it actually taught us that we don't really have to physically be with the patient when engaging in a consultation process, some of the time anyway. So let's go through, and if you have any questions, I'm monitoring the chat, and feel free to ask questions. So some people want to know what exactly is teleconsultation. It is just one aspect of telemedicine, and it's a remote consultation using modern communication tools. I mean, we had the phone, text messaging like WhatsApp, Facebook Messenger. People have used even now and in the past. But I think I would like to define it as using modern audio visual communication. And this is actually very important. In the next slide, you'll see why. I think it has to be not just audio like in the phone call, but it has to be visual as well in proper teleconsultation. It's because of this very important thing involving identification. I think we have to make sure we are engaging with patients with whom we have properly identified. And the best way to identify them is visually. And if in case that's not possible, then the telemedicine system has to involve a registration process. But I think there's nothing better than actually seeing who you're talking with. So in that sense, I often tell my patients, there's no point you phoning in and asking me for advice and so on, because I have to be sure whom I'm talking with. And if I can't see you, then it's not proper. In fact, this is one of the requirements in the recent MMC guidelines on teleconsultation. If in doubt and you're not sure, especially if it's a patient whom you're unfamiliar with, then you can even ask the person to show his or her ID, okay, such as a driving license or IC in the visual encounter. Another important aspect which you must pay attention to is when you perform teleconsultation, make sure that you have taken informed consent prior to the session. It could be in the process of clicking on to join the teleconsultation link. There was already a digital consent form, or it could be actually be a paper consent form you've taken in the clinic prior to say, in the next time you want to perform teleconsultation with me, then you have to go through all the informed consent steps. I think some of the things which are important are, number one, you should say that teleconsultation has its limits. And the obvious limit is you cannot perform a thorough physical examination other than visual and auditory examination. You cannot palpate or feel or examine the patient with your hands. So that's an important limitation. The other important limitation is, I think we should emphasize that teleconsultation should not be an emergency service. So if you say it's an emergency service, then you should be available 24/7, which is not possible most of the time. Okay, so I think your teleconsultation should include at least these two things, and I include a sample in the link in the slides for teleconsultation consent, should you want a template. Another question which pops up every now and then is people are not sure whether our medical indemnity, such as MPS, Aeon, MedDefend, Dr. Shield, and so on, cover teleconsultation. I think before you start, you got to make sure that your medical indemnity covers it. And I'm aware that MPS has said they will cover teleconsultation, and you do not need to inform them you're engaging in teleconsultation. The only thing they say that you have to follow local guidelines and standard ethical procedures when engaging in teleconsultation, and use proper platforms. I think they sort of frown on if you use like Zoom or some of the non-medical social platforms to engage with your patients. So I think you have to be careful how you engage your patients. Otherwise, MPS may not cover you. Some may cover you. I do not know with the other medical indemnity platforms, but just check with them. Okay, I think Dr. Shield will cover you as well. Yeah? The other thing is we have to comply with whatever our local medical council has spelled out in the recent advisory, because that's sort of supersedes, not so much. There's a Telemedicine Act in 1997, but it has never been enforced. And I actually made a personal inquiry with the MMC, said they have not put it in force. So actually it's very old already, and it's actually due for an overhaul, but it has not yet, it's in the process. All these regulations and new legislation is in the process of being done up. But in the meantime, this year, MMC has given de facto recognition of teleconsultation, and it issued an advisory which you should read through, and it actually says what you can or cannot do, or what you should do, and what the best practices are. Much of which I've summarized in this talk. All right. One of the important things MMC has stated in its advisory is that they say that it should only be for follow-up patients. So I think you should be wary about engaging teleconsultation with patients whom you've never seen before. There is a little caveat in their advisory. They say that medical advice, this does not include general health advice, which I guess is permissible for new patients, but it's not very clear. So it's a very gray area. I think in the COVID era, people are just calling up for advice. They're very worried about their symptoms. So some general health advice is permissible. But I think a full teleconsultation, like where you are conducting diagnosis and possibly even prescribing treatment, I think MMC is quite wary about this when you're engaging with somebody you've never seen before. So I think if you stick with your own follow-up patients, it should be quite safe. I have also some questions which are not answered. For example, people may want to engage with you for the first time, but it's not really a normal, problem which requires diagnosis, but they sometimes just want to see you for a second opinion, or perhaps they want to inquire about the procedure to find out some details before they actually come. And now these are actually new patients as well. So, when the council says health advice is permissible, it's not clear whether it applies to this as well. But we will await further clarification, because the MMC has stated its advisory is a work in progress. So I think there needs to be a lot of refinement and new things added. To make life easy, I suggest you have an appointment system. Otherwise, it's difficult if teleconsultation requests come in at any time of the day or night, and people are unhappy if you're not available, and so on. If you have an appointment system and a visit is scheduled, it will make your life easier, believe you me. So you can allocate a specific time for teleconsultation, say maybe between 8 to 9 in the morning or 5 to 6 in the evening. So you specify, you make time, and then the patients book an appointment, and when both of you will be able to come together in the same time for that teleconsultation session. And it is very much more doable this way. So ad hoc or any time of the day teleconsultation is difficult unless you're going to do teleconsultation full time, which means you're not just a concierge doctor. But if you have a real life practice and you want to have some teleconsultation, then appointments will be highly advisable. So there's a question in the chat: what appointment system do you suggest? If you are part of a hospital group, like my hospital also has started telemedicine, and they actually have a vendor who has an appointment system built into into the teleconsultation whole ecosystem. If you're a solo practitioner, I have a suggestion which I'll mention towards the end, and it's free, and I use it actually in my current practice for my personal teleconsultation service. So stay tuned. Okay, I'll mention it towards the end of the talk. The other thing which I think is very, very important is when you are engaging in teleconsultation, you should have the records of the patient in front of you. That means you either have the paper records, or more ideally, if you have an electronic medical record. EMRs are, of course, better than paper records, especially if they are cloud-based, means that you can actually perform the teleconsultation wherever you are. So you just log into your system, and then you view the case records. Do not try to remember just using your memory alone or to recall the case details. I think at some point in time, if you do this, you will be caught up, and then you'll make mistakes. So it's also always better to have the records in front of you, not just for recall, but also for documentation, which is the next thing. All right. The MPS had a webinar on the teleconsultation, and they said that, of course, it's like a normal clinic visit. They expect you to document your session thoroughly. They have said you do not have to make an audio-visual recording of the session. And some people say, oh, you must record. But we don't record our normal clinic encounters anyway. All we are expected to do is to document in your medical records the teleconsultation session. So just make sure you have it fresh in your mind, or even best is actually have the records in front of you. So while you are talking to the patient, actually you can type and make notes. And that way, that will be the ideal way. Yeah. Now you need to defer to a physical visit. Say so. I think this threshold for deferring to a physical visit should be quite low. So whenever necessary, you tell, I can't really, like, be sure what exactly you have. Say the patient complains of pain in the shoulder, then you advise your patient that he or she needs to come to the clinic and be examined. I may not be able to diagnose a problem adequately with just listening to his or her story. Although, I mean, we are taught in medical school that history alone, over 90% of the time, you can advise your patient what the diagnosis is likely to be. So I think the message is, whenever you feel you really need to see the patient, then say so. And then also the urgency is given as, you need to go to the ER stat, or you can come next week. I think it's based on your clinical judgment. Yeah. The other thing is, if you do give some health advice, it's always better to have that if not better clause. I always say, okay, you can take paracetamol for the pain, but if not better, do come to the clinic, and then document that as well. There are some gray areas, and which are not very clear, even with the MMC advisory. One of them is actually patients who are based overseas, and sometimes even they are follow-up patients, but they may have been traveling. This is a pre-COVID era, or even now with the recovery MCO. If they can travel, but if they happen to be overseas and then run into trouble and they want to contact you, so is this allowed? I think from the MPS webinar, I think they say it's okay, because it's like the owners, I mean, we are trying to look out for our patients. So it's a part of the duty of care to actually respond to patients when they are in need. And we have a method where there are no physical barriers or distance barriers. So if they run into trouble, if they contact you, there's no reason why, as part of the continuity of care, you can't actually engage with them using teleconsultation. Again, if the need to defer to something physical, or they need to see, then you can say, I'm afraid you need to see a local doctor to attend to you, and then you say so. If it's something which you deem is not, it's just simple health advice you could give, maybe they have some health queries which are quite simple, then you don't have to defer to a physical visit. So I think it's okay. First consults I've touched upon earlier. I think until MMC clarifies on this, what is permissible as a first consult, I think it is better. I would feel more comfortable not engaging in first consults and just using it for my follow-up patients. The other bullet point there is, what about fees? Can you charge fees? The previous government, the health minister has mentioned, and it was quoted in the press, that professional fees are now no longer regulated, though I've not seen anything from MMC after that. But I think, people are already charging for telemedicine, teleconsultation, and there are teleconsultation companies providing that for a fee. Hospitals are conducting telemedicine for a fee. So I don't see why you, as an individual doctor, if you engage in teleconsultation with your own patients, you can't charge a fee, as long as your fees are reasonable. I think reasonable meaning it probably shouldn't be more than what you would normally charge for a normal follow-up visit. E-prescription, I think we have to be extra careful here also, because if they are follow-up patients and the prescription is more for standard items for such as non-communicable disease like diabetes, hypertension, and so on, is okay. But if you're going to prescribe sedative hypnotics or other drugs, DDA, so-called DDA drugs, I would probably refrain from that. Yeah. So I think you be careful with e-prescription. Since we are not engaging with first consult, so prescribing and making a presumptive diagnosis, prescribing does not apply. Okay, the other common question, Azin, is what platform? Oh, we'll go back. Somebody asked, what about antibiotics for e-prescription? I think it's okay if it's something which you think a physical visit, you don't have to defer to one, which is like 99% sure this is a likely upper respiratory tract infection with some suggestion it could be bacterial, and you know the patient's history is not allergic to penicillin. You want to prescribe augmentin or unicin or some penicillin-based things for a presumed throat infection. I don't see why not. Okay. But I think, again, if you worry that you really need to examine the patient and you're just not comfortable with prescribing antibiotics for where the diagnosis is not totally clear, then say so. I think, again, threshold for deferring to physical visits is very low. Now, which platform? Again, you have to be careful with what you use. Someone says, why can't we use FaceTime or Zoom, Google Meet? All these are free to some extent, or some with subscription, but they are not really medical grade, so to speak. I think we have to look at, see whether they comply with things like the PDPA, privacy, and whether they have adequate security. So if something which is American HIPAA, HIPAA compliant, I think we can be quite confident that the provider has complied with that level of medical compliance and security. So I think the other thing, so like Zoom would not be a HIPAA compliant platform. So I'll be worried in view of recent security issues with Zoom. Okay, they are not encrypted end to end. Okay. It should also be easy to use. All right. So if you have something which is sophisticated and very tight security, but it's very difficult to use, in the end of the day, it will defeat the purpose of teleconsultation. If you're working in a hospital group or hospital where it's provided, or you are part of a teleconsultations commercial platform, you have to ask yourself what the business model is. I mean, nobody is going to give everything for free. So you have to be sure, if you're part of the group, what the business model is like. So before you go plunge into the teleconsultation service. Sometimes you may want to give the service free. It's part of goodwill for your patients. And I personally do it when I want to provide results which are late coming. Let's say something will come out a week later or 2 weeks later. I see little reason why the patient should come back, travel maybe 10 kilometers, 20 kilometers to come back to collect the result and get an explanation of the result, when a simple teleconsultation session can just provide the patient with the result and explain, and then everyone is happy. And actually, I'm happy too, because I set up a teleconsultation appointment for my patient. In fact, I just had one yesterday where I use it as a reminder to trace the result. And then during the session, I provide the patient with the report and then a simple explanation. Whole thing took something like 5 minutes, and then you end up with a very happy patient. So, and I this sort of thing I don't even bother to charge, because I feel it's just part of the professional service. Sometimes you want to have a pay per use or even a subscription model. It's up to you. Okay. Now, the appointment system I alluded to is setmore.com. I will spell it out in the chat. So setmore.com is the basic service is free, and for up to a certain number of people who can run the platform, and but otherwise your patients can use it to set appointments based on the time you allocate for telemedicine. I find it very highly configurable. There's a little bit of learning curve with setmore.com, but you will find it's quite easy to use. And I get notifications when it's time for the appointment and so on. I recommend you check it out. So setmore.com. The other thing about the actual teleconsultation system is, I said, I would prefer one where it's a face-to-face proper teleconsultation system, but I would like also whereby there's ability to text during the session, because sometimes patients may not be able to understand very long medical terms, so it's nothing better than to spell it out or something else. Where file transfer is also available is useful, because sometimes you want to send reports or receive reports from patients. Sometimes you want to share your screens, say for health education, you want to share a video, or you want to share a diagram or draw something out for the patient. And then single or multi-participants also is something you need to consider, because in this day and age also, family units are separated. So maybe you have a patient in KL, but the daughter is in Penang, the son is in Singapore or UK, US, or wherever. But using a multi-participant platform, you can engage everybody for, say, a counseling session. And counseling is actually one of my major uses of teleconsultation. In fact, I had a very sick patient in ICU, and it's very difficult for me to meet up with the relatives who will come at whatever time. So in order to update them on their loved one's progress. So I use teleconsultation to actually meet up with the relatives virtually, and then I just update them at fixed times of the day. So it makes my life easier. I don't have to physically head to hospital, ICU, just at that time to meet up with the patient's relatives. Okay, whether we should make medical notes in the platform, I think that would have problems with HIPAA compliance and security. It's best you make your medical notes in your separate electronic medical record or paper record. Whether the system can allow you to prescribe or have lab requests is another thing you need to consider. But again, anything where even a file transfer, you can actually send an ePrescription or lab request in a digital document. So these are ways whereby you can get around with it. So group practice, corporate solutions, there are quite a number coming up now, already in place. So there are a lot of hospitals in the Klang Valley have launched their telemedicine systems. But I think I just want to tell you what you as an individual doctor can use. And these are two things I would recommend in two systems. One is teleme.co, and it's free for you to subscribe as a doctor. You just go there, sign up as a doctor, and they will have service for text messaging, face-to-face consultation, prescription, lab requests, and it's not bad. And there's a inbuilt billing or charging system where you can set your telemedicine fee as well. If you like, you can use also something which I'm currently using as well, and that's doxy.me. The basic usage is free. Go to doxy.me, sign up as a doctor, and you can configure a telemedicine waiting room with your name. So doxy.me / say Dr. Chan or something like that. And the patient just needs to click on that link, and the telemedicine session will start when you allow it, when both of you are online at the same time. And it works in the browser. I find it's extremely easy to use, because patients do not need to register, do not need to use any app, and it works in the mobile phone, iPad, or laptop browser. As long as they have a webcam and microphone and a decent internet connection, it works very well. If you want more features like file transfer, screen share, multi-participant, then it comes with a subscription option. But if you want to try it for free for yourself with just a basic sign up, I highly recommend it. As long as you and the patient has a decent internet connection, it's quite good. There's also text chatting, which is part of the free service. Okay, so they are improving, and slowly and more things are being added, I'm a subscriber, and I'm quite happy with the professionals package, which has all the features which I want. Somebody asked also for appointments, what can you use? I recommend. I've gone through quite a few of the free systems available online, and currently setmore.com is a good one to try. If you subscribe to the professional version of Doxy.me, it comes built in with integration with Stripe. Stripe is a billing service similar to PayPal, so you can actually bill for your service and the patient pays by credit card. If you're a professional subscriber to Doxy.me, you can bill in call the patient. Or if you are a subscriber to Setmore, you can also bill Stripe. So they're billed to make an appointment. But if you're not a subscriber, then the appointment is made for free on the patient's side. However, this doesn't stop you from being a user of Stripe, and you can actually send the patient an invoice through Stripe. It goes to the patient's email, and they pay after or before the session, up to you. So you can actually use Stripe as a billing system if you don't have one yourself. All right. So I think these are a few services which I can suggest to you. But feel free to ask more in the question in the chat. Okay, I will stop here. What I'm going to do is I'm going to generate